guys. This one's gonna be another bummer of an episode. I'm gonna talk about drug overdoses in the United States, specifically Los Angeles. That's where I work. Um, my mom, or first of all, I'm only an EMT. I shouldn't say only, I'm an EMT. Um, that's my credentials, certification. I worked on the ambulance for a few years. I've been in the hospital setting for past 2 years, going on three. Um, so I've been able to see and interact with a lot of people who use drugs. I've seen a lot of drug overdoses. I've seen a lot of opioid overdoses, the reversals, um, cocaine less so, but I've seen all types of drugs, um, all types of people who use drugs. And this isn't this. I mean, this is for education, but I guess this is more just like a space for me to kind of vent about where we're at currently, the American healthcare system, and kind of where we're going as far as drug overdoses in um, in Los Angeles specifically, because that's the only place I've worked. Um, my mom, she works in Los Angeles as well. She's an MD in the emergency room. Um, and she also worked in Michigan, so she has a little bit more experience outside of Los Angeles. Um, so the drug overdose rate, last time I checked, in 2022, last year, it was about 110 overdoses on the year, the calendar year. And that's like the highest ever recorded. Um, so it just keeps going up. I don't know what the numbers are going to look like for at the end of this year. It might hit a new record, but I mean, it might just be hovering around 110,000. But 110,000 overdose deaths on the year. So it's very much an epidemic. It keeps on going up, and more people are becoming like acutely aware of fentanyl. um, People have been um, it's becoming more part of like the mainstream consciousness. The general population knows about fentanyl and how dangerous it can be. And it is definitely. But I guess I kind of just want to say it's getting worse. Fentanyl is honestly kind of mild compared to what drugs are on the street these days. Um, when I first got into healthcare, I got my EMT license 2017. Um, and we were already like very acutely aware of fentanyl. There were like signs at the ambulance station. If you ever come across fentanyl, don't touch it. This is what it looks like. This is what it does. Just a little bit of fentanyl and you'll overdose. And that's true. Fentanyl is extremely strong. Um, was it? I could go a little bit into the opioid epidemic. Um, the was it? It began really with the overprescription of pain medication. A lot of people know about this, like the Sackler family, Purdue Pharmaceuticals, oxycodone. It was overprescribed, and the risks of addiction were very much understated. Um, these companies made a lot of money getting people hooked on prescription painkillers for stuff that they really didn't need. So people were overdosing on it. You know, it's possible to overdose on prescription painkillers, but what really got bad is when they stopped prescribing pain medication. Doctors became aware of how dangerous it is, how easily it can be overprescribed. So it went from one stage of overprescribing pain meds to the second stage where people started to use heroin, because heroin is also an opioid, and it's cheaper. Sometimes it is more accessible on the streets. So there was a big rise in heroin overdoses. Now that was more dangerous. The needles, a lot of increase in sexually transmitted diseases. Because of like people using the same needles, the blood to blood contact, you can get an STD that way. They're also STIs, sexually transmitted illnesses. Okay, and then the third phase. Third phase is fentanyl, because a lot of dealers, uh, in order for profit motives, they started cutting or mixing the drugs, heroin with fentanyl, and this is considered like the third phase of the opioid epidemic. Um, and this is where we see like the massive increase in overdoses. I think it was something like 50,000 overdoses in like 2017. Sorry, I'm paraphrasing, but it doubled pretty much, the amount of overdoses over the past few years, um, because of fentanyl. But also, I think we're approaching like a fourth stage. um, I there's a new drug to cut, uh, on the market, um, and the xylazine and benzodiazepines, um, benzodope, and xylazine is also referred to as tranq, horse tranquilizer. Well, it is not just used for horses, but it's also used for like smaller animals, rodents. Um, but it was made for animals. Xylazine, was made to be used as a tranquilizer for animals, and now drug dealers are using it to cut their drugs. And it we there's uh, we saw a lot of xylazine use in Philadelphia, and I remember maybe a few years ago, 2019, I saw like a Vice video on YouTube about how this new drug on the market is making fentanyl look mild. And I was pretty curious about what this is. They're talking about benzodope. They've talked about xylazine, and I I told my mom like, oh hey, well, we should look out for this in the emergency medicine. Um, and sure enough, because Los Angeles is second biggest city in the United States, um, you know, any trends are gonna like come through Los Angeles, and xylazine, benzodiazepine, no different. So we started to see more patients with um, the it's what really sets it apart from fentanyl, is the fact that since it's not an opioid, it's not reversed by Narcan. Narcan is very useful, tool to if somebody was overdosing on oxycodone or heroin or fentanyl, it would respond well to this drug called Narcan. You spray it up people's nose. You can also give it in IV. It's stronger that way. Um, but uh, we would see a lot of patients in the ER. They would come in. It caught these drugs, those three that I mentioned, like oxycodone, heroin, and fentanyl. They cause um, it like they cause sedation, and it makes you stop breathing. Um, it slows down your breathing rate. You can go hypoxic. Some people stop breathing altogether. Um, in EMT school, the way that my instructor kind of described it is people feel so good. It's like a very euphoric feeling off of those drugs that they actually like forget to breathe. It depresses their CNS, sensor, central nervous system, and it causes them essentially just to forget that that what drives them to breathe. Um, and it's very responsive to Narcan. You put it up their nose, and within a few minutes, they wake up. Um, Usually, they start going into withdrawal pretty soon, um, and they're usually pretty mad because that euphoric feeling goes away as well. But this is all stuff that we know. I and it's this trends with xylazine and benzodiazepine really concerns me. Um, because it doesn't respond to Narcan. Now, it also doesn't cause um, the the slow breathing, patient stop breathing. It doesn't cause that, but it does inhibit their central nervous system to the point where if they vomit, and they do vomit a lot off of these drugs, um, and they block their airway, they're not going to wake up. They're just going to have a blocked airway, and like they'll pass away. They'll die from it. Very common way that people pass away. So it's very concerning. It doesn't respond to Narcan. Um, so a very common patient is fire department brings in a patient. They're overdosing. They're completely intubate or not. They're completely sedated, and they gave them maybe two, 3 rounds of Narcan up the nose, and nothing is working. They're still sedated. They're not waking up. Um, and we'll manage them, wait for them to wake up. Usually takes like 4 hours. I'm gonna link a video where MD goes through pretty much all of this. Let me actually pull up his name. Dr. Joseph D'Ozario. Yeah, I'm gonna link his video in the description because he actually goes through a lot of like how it actually works, um, the actual the pathways in which it affects the nervous system. I'm talking about xylazine specifically right now. Um, and yeah, so like a very common patient, uh, and there's no way for anyone in the emergency department to actually test it. We can't do like a urine analysis and see, oh, well, this is xylazine. We just have to know that it's Narcan resistant overdose causing sedation. A lot of times there'll be wounds on them. Um, and you get this like sixth sense. I wouldn't even call it a sixth sense. But you do become pretty acutely aware of people who use drugs in the ER. You can just see like, oh, okay, well, I can see these wounds on them. I can see injection sites. This is definitely like uh, a classic somebody who a person who uses drugs. So um, I'm just trying to say it's very concerning. Um, and I've seen there's a lot of videos for people talking about xylazine and people who use drugs, and these users they're actually seeking out fentanyl, which is kind of crazy to think about. Fentanyl is basically like this boogeyman of America. Like, oh, this little amount of fentanyl can kill you. A lot of law enforcement officials saying, oh, this, if you even touch fentanyl, it can cause an overdose, which isn't true. Um, Always it gets me very upset whenever I see that. But the fentanyl is like this boogeyman, and there are drug addicts that are actively seeking out fentanyl because the drug supply is so cut with xylazine or benzodope um, that it's actually preferable to get your hands on fentanyl. So it's very, very concerning to me. Um, the drug overdose rate it only gets higher. These people who take xylazine usually it's by accident, and then they come back, uh, they come off of their high, their sedation wears off, and they go through withdrawal like immediately. They become extremely anxious. A lot of times they have like wounds. It's like a cycle, you know. They're caught deep into the cycle, even more so than opioid addicts. Um, so it's just very concerning to me, um, what I'm seeing, and that number, 110,000 overdoses since last year. I mean, I really think that it's only going to get worse. Um, we'll see what it's at the end of the calendar year. Probably by like February 2024, we'll have good numbers for 2023, but it's bad. And it's good that people are talking about it, but it took forever for people to even become acutely aware of what fentanyl is and how people are overdosing on fentanyl. Um, we're only saw it go into like the mainstream consciousness recently. So obviously, I don't have any solutions or anything. I just want to kind of raise awareness. Um, I'll link the video of the MD going through xylazine overdoses, xylazine withdrawal, like what people who use drugs, how it affects people who use drugs. But yeah, that's all I really have for today. Stay safe out there. Don't use drugs, kids. That's all. I'll see you tomorrow.